Hi everyone, I hope you're having a good evening so far and enjoying the medical education session so far. I'm sorry I couldn't be there tonight. I'm in Atlanta doing an away rotation at Emory, but I thought I would bring my presentation to you virtually. So my presentation tonight is about tick-borne illnesses. The objectives for tonight are for health professional students, or all of us, to be able to recognize the impact of tick-borne illnesses on the North Carolina region, since that's where we are training and practicing at this time. We should be able to identify patients with risk factors and symptoms of tick-borne illnesses, select proper treatment for suspected or confirmed tick-borne illnesses, and counsel patients about prevention against tick-borne illnesses, as well as be able to take these precautions ourselves when enjoying the outdoors. So why am I interested in this topic? So first off, how many of you have been out hiking this summer? Anyone been out mountain biking or walking your dog? How many of you have even been outside at all this summer and seen some type of nature? If that is the case, then you have a potential tick-borne exposure since we're in the North Carolina region. So for me, I love hiking and being outdoors. When I was in Arizona, my concern when I was hiking was seeing scorpions. Since moving to North Carolina, I think about ticks a lot when I'm out hiking and trying to prevent those. First off, the epidemiology, or where are the ticks, what types are they? So there are three main ticks that I'd like to focus on today, as well as the four main diseases that they cause that affect our region. So the three different ticks that I'm going to talk about are the Lone Star tick, which you can see up in the left-handed corner. When asking patients to describe ticks, if they're able, this is the one with the one white spot on their back. The black-legged tick is the one over in the right-handed corner. It's about half brown, half red when you're asking patients to describe this one. The dog tick is a little bit more tricky. It's kind of white and brown when asking patients to describe it. And there are diseases that are associated with this. So ehrlichiosis, which you can see here, I've circled North Carolina in red, so that can affect us, and it's caused by the Lone Star tick. Lyme disease is especially prevalent in the upper Midwest and the northeastern part of the country, but it has been making its way to North Carolina, and that is caused by the black-legged tick or deer tick. Rocky Mountain spotted fever is a really heavily prevalent in our area, and that's caused by the dog tick. And then anaplasmosis is a little bit more rare in our region, but has been making its way down. It's more commonly found in the upper Midwest as well as the northeastern states. And that one can be caused by either the Lone Star tick or the black-legged / deer tick. The clinical diseases that these ticks can cause include Rocky Mountain spotted fever. For all of these, I'm going to break it down by the cause, the tick, signs and symptoms, and the lab values. For a lot of these, the signs and symptoms overlap, and so even if you have any type of suspicion for a tick-borne illness, it's not as important to delineate which one, just that you recognize that it's a tick-borne illness. But it can come up on standardized testing, so that's why I'm going to bring it up briefly here. So for Rocky Mountain spotted fever, like I said, it is caused by dog ticks carrying the bacteria Rickettsia rickettsii. Signs and symptoms include a rash, which affects the extremities first, the hands and feet, and then moves up to the trunk. You can also get a fever, headache, and GI symptoms. Labs that you would potentially see in this patient are hyponatremia, low platelets, and elevated liver enzymes. Lyme disease is caused by the black-legged or deer tick carrying Borrelia burgdorferi. Signs and symptoms would be the targetoid rash seen early on. You can also see headache, fever, and body aches and pains early on. The only lab finding I saw that you could really see with this is an elevated ESR, which is very nonspecific for inflammation, but you can see that. Anaplasmosis, like I mentioned previously, is carried by the black-legged or deer tick. It is caused by Anaplasma phagocytophilum is the bacteria. Signs and symptoms, you get a maculopapular rash, fevers, chills, headache, malaise, altered mental status, nausea, vomiting, diarrhea. The rash that you see in both anaplasmosis and ehrlichiosis is less common when people have this disease. So sometimes it's been called Rocky Mountain spotted fever without the rash. Labs you can see are decreased white blood cells, decreased platelets, decreased red blood cells or pancytopenia, as well as elevated liver function enzymes. Ehrlichiosis caused by the Lone Star tick vary almost identical signs and symptoms and lab findings that you would see compared to anaplasmosis. So this table is really helpful when you're kind of thinking about your patient and some of the lab values that you may see. Diagnosis and treatment. So for all tick-borne illnesses, like I alluded to earlier, your clinical suspicion has much greater weight than a lab test. These lab tests can take several days to even weeks to come back, can be hard to obtain if you're in a smaller center, and it really impacts outcomes. So if you have a gut instinct or even a small suspicion that your patient has a rickettsial-borne disease, it is worth starting treatment immediately. The labs that you can get are PCR, trying to amplify the DNA for the different bacteria that you can find in the blood. It's also worth getting an IgG antibody test, which will be negative in the first week. However, on a repeat test 2 to 4 weeks later, it will be positive. So it's kind of an after the fact confirmation that they had this condition. The treatment, so this is a brief sketch from the Sketchy Micro series. This is talking about the tetracyclines. So doxycycline is the treatment of choice for all rickettsial illnesses. However, in certain conditions, kind of alluded to by this picture, amoxicillin is the treatment of choice. So if the patient has Lyme disease and is pregnant or is a child less than 8, amoxicillin is the recommended treatment. And the reason for that is because doxycycline can cause teeth discoloration that is permanent. However, for all other rickettsial illnesses, doxycycline is the recommended treatment no matter if you're a child or if you're pregnant, because it is the most efficacious for those diseases, and the risk of having discolored teeth is small compared to the clinical severity of the diseases. So how can we prevent this from happening? So big things are wearing insect repellent that contain DEET, wearing long sleeves, upper and lower extremity when you are out and about and hiking, treating dogs and cats, so just making sure they're going to the vet and getting the required vaccines and medications to help prevent this. This is a picture of my dog, Twinkie. He also has to now deal with risks of tick-borne illnesses since he has moved from Arizona up to Michigan. And if you are hiking, check for ticks daily on yourself, loved ones, and your pets. And if you do notice a tick, proper tick removal is very important. So to do so, you take tweezers and you kind of grab the tick by the base and then lift straight up. Something new and up and coming for tick prevention is potentially opossums. This is that little guy down here that you see. He's pretty cute. But some researchers up in the Northeast have found that opossums can eat up to 2,000 ticks in a tick season, and they themselves do not become carriers of ticks or the diseases. So potential role for a new furry friend in your life. So a brief overview. If it is the summer months, you're in the right geography. So we're thinking the Southeast, Northeast, or upper Midwest. If your patient has a rash, fever, GI symptoms, fatigue, myalgias, you should be thinking a tick-borne illness. And your clinical suspicion outweighs any diagnostic labs that you may obtain. And it is very important that you timely and immediately treat with doxycycline, with the caveat being amoxicillin if it's Lyme disease and they're pregnant or less than 8. And if you or your loved ones or your pets are going to be hiking outdoors, taking those preventative measures to prevent tick bites and tick-borne illnesses. And if anyone has any questions, I should be live FaceTiming or Skyping in, and I'd be happy to answer them. This is a shot from when I went hiking up in northern Arizona a few years ago. Here are my references.